Good morning, it's Kate from Core Wellbeing, and this whole post training seems to get the body flowing, get the brain flowing. I always feel like I have more to say. Thoughts just come into my head, so why not get them out? I wanted to chat to you guys today about kind of gut health, but there's so many aspects to this. So, more specifically, I want to talk about different overgrowths that people can have, so bacteria, yeast, parasites. And more down the testing sort of avenue, and why I feel it's really important, and why I also wouldn't recommend going to antibiotics as a first sort of treatment approach. That's not to say that I don't feel that they're warranted, and in certain situations they absolutely do need to be a first approach, but there's a lot of reasons why that's not necessarily a good idea. So gut is super complicated, and the symptoms that people experience, the length of time that people experience them for, the organisms or the factors that are driving those symptoms. There's so many things that need to be considered, and if you're experiencing digestive issues, I really, 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 really strongly advocate you working with a practitioner. Not to say that you can't do bits and pieces on your own, particularly with modifying your diet, but it really is an area that's so complex. And I have to say that even myself as a practitioner, and a practitioner who has experienced digestive issues for most of my life, I've delved into this a lot, and I still don't understand it all. I really do not claim to know everything, but what I do know is that I'm committed to my patients, and I'm always committed to exploring the different avenues of testing and treatment, and working with doctors as well. And I never close the door. I never say, well, that's it, we've tried everything, and therefore you're just stuck with this for the rest of your life and you have to manage it. And unfortunately, that's what I've had a lot of people be told. And yeah, it's just mind-blowing. I realize I'm in a situation where obviously the people who are coming to see me are generally coming because they have some sort of health complaint, but this digestive stuff, food reactivity, parasites or bacteria, yeast infections, inflammatory bowel disease, celiac disease, you name it, it's just like, I feel like I'm actually surprised when I go through someone's case history and I ask them about their digestive health and their digestive function. If I say to someone like, "Oh, do you ever experience bloating or any pain, whatever?" Like, we're kind of exploring that system. And if someone's like, "No," then I'm like, "Really? What is that like?" Like, you've never been bloated? You've never had irregular bowel motions? I'm finding it to be more and more rare. Okay, so I guess let's chat about the testing. Let's rewind. If you're experiencing anything like bloating, reflux, digestive pain, cramping, diarrhea, constipation, swinging between the two, feeling of fullness, nausea, vomiting, anything along those lines, then definitely worth investigating your gut. Obviously, if you're eating a diet that is pretty shocking, you're eating lots of refined foods, you're having heaps of sugar, if you can sort of see that there's dietary things that could be in the way, explore those first. And I would even go as far as to say that if you take out gluten and dairy and possibly consider eggs, then even start there before you go and see a practitioner. See what changes. It may not solve it, but you may get some symptom relief. And then at least, I guess I always say to people, it's like peeling off the layers of the onion. So once you kind of remove something that's causing some irritation or inflammation, it allows you to better see what's sitting underneath, and you can work more specifically then with that. So once you see a practitioner, you've identified that you've got some symptoms, I would strongly advise doing testing. Now, testing is expensive. I'm not going to lie, I can't sugarcoat that. Testing is really expensive. The stool test that I use is $500, and that is not something that I am making money off. I think I should clarify that because I really encourage people to do it, but not the only benefit I get from it as a practitioner is getting that really sound information in front of me so that I can work more specifically and in a really targeted way with you. So the test that I use is through a lab called Doctors Data. It goes over to the States, and the technology that they use is far more advanced than what we have access to here. So they're able to assess, I won't go into all of it, but if you do want me to, I'm happy to do a big video on specifically the technology and why I feel that lab is the best. But basically it's assessing any bacteria, so both beneficial and pathogenic. It also looks at any yeast, it looks for any parasites, it looks for inflammatory markers, it sees your digestive capacity, so assesses your enzyme sort of function. It looks at, what else does it look at? Your gut-based immune system, so your secretory IgA, obviously looking for things like blood as well, mucus, and one of the things that I really like about it, and this is I guess where I wanted to talk a little bit more about the antibiotics versus natural approach, is that this particular test does susceptibility report. So basically it takes whatever organisms it detects for you, bacteria or yeast. It can't do it with the parasites because they behave slightly differently. You can't really you can't culture them and then test the different agents against it. But any bacteria or yeast that is found to be dysbiotic, so out of balance, they will then test those against bacteria. Oh my gosh, sorry, my brain. I was on a roll. They will test those against specific botanical and pharmaceutical agents to see what it's sensitive to. The really important thing is that, let's say we detect something like Klebsiella, so it's a strain of bacteria that can cause digestive issues. They all can. And so Klebsiella for you is found to be responsive to, berberine. And so then, but that may not necessarily be the case, and what possibly is the case for other people. The benefit of this test is it's taking your specific sample and your the organism that's living in you and testing against those agents. So what I'm finding is that people, when they've had a lot of these digestive issues, they've experimented. So they've taken herbal antimicrobials, or they've taken antibiotics, or they've done their own bits and pieces, and these organisms don't want to go, so they do become resistant. So by doing the susceptibility report on your specific sample, you're finding out exactly what's going to kill the organisms that you have for you. Does that make sense? I was going so well with this explanation, and then my brain goes in 5 directions at once and it's hard to bring it back. Basically, it makes it really specific and really targeted. The other good thing is, let's say you have someone who has really bad diarrhea all the time, and it can be pretty awful for people. It makes it hard to go to work, it makes it hard to exercise. It depends on the extent of it. But let's say that we do the test and we find that you have multiple different organisms that are dysbiotic, and those organisms all come back that they're responsive to 1 or 2 antibiotics. In that situation, I would say go and do the antibiotics, because we want you to get out of this really acute situation where it's impacting the quality of your life. This all impacts quality of life, but I think we can all agree that if you have quite a lot of diarrhea, and it's, for some people it is uncontrollable, which is horrendous for them, in that situation I wouldn't want to take the time to do the herbal antimicrobials, because we need to get these people out of what they're experiencing and then knowing the state of the rest of the gut. So in this test it does tell me the beneficial bacteria, and I guess how your good flora are standing up against the bad ones. And it tells me about, the level of that secretory IgA, so that gut-based immune system. I can kind of know more about how your gut will cope with the antibiotics, and then what we need to do to go in and mop up the damage afterwards. So it allows you, to really target it. And it's if you want to go down the antibiotic route as well, you know exactly which strains are going to kill the organisms that you have. Because plenty of times, I was working with a client last night who he had antibiotics previously for a bunch of bacteria that had come up, and this is actually probably a good one to talk about. So in his sample, we detected quite a number of strains of bacteria, and we also detected quite a number of strains of yeast. Now, he'd seen gastroenterologists, he'd been down, I guess, that medical route, and he had been prescribed antibiotics, which didn't actually help. So the bacteria that were detected for him, they were resistant to many of the strains of antibiotics that were tested. So I don't actually know which ones he was prescribed, but given that it didn't help, I would suspect that it was one of the resistant strains. The other issue there is that antibiotics does not kill yeast. So if you're finding, which I am finding, most people have both bacteria and yeast causing problems, if you've wiped out the bacteria and maybe you picked the antibiotic that'll work really well, but you've now got this yeast, and they're all opportunistic organisms. So once you, I guess, create that environment where you're wiping out bacteria, bad and good, then that yeast is like, woo, now it's my turn to thrive and have a party. And you can potentially worsen symptoms. They may change, but you've not actually gotten underneath it all and corrected anything. Does that make sense? I know you can't really answer. I wish this was like a two-way thing, but give me some feedback. I'd love to, keep emailing me, leave a comment, send me a message on Facebook, however, reach out. I'd love some feedback. I guess that's kind of in a nutshell why I really recommend testing, because there's so many variables at the best of times, and let alone, we just don't know that much. Like, we're at the tip of the iceberg for what's going on within the gut. We know it's really important. We know that it drives most conditions, and it's connected to everything in the body. But if we're having this situation where you've got these organisms living there and we're not really targeting them effectively, then we're potentially worsening the situation. Parasites is a whole nother story. Excuse me. And they can be a lot more tricky to work with. And I always have to remind clients, and myself, to be honest, that this takes some time. It's something that you really do need to commit to. And it's not just that you take a pill and keep doing what you're doing and that's it. It really takes time. It takes commitment. You are going to have to overhaul your diet. You are going to have to be really restricted for a while. These organisms, they feed off carbohydrates. So generally we have to pull out a lot of sugar, a lot of grains, a lot of fruit. And it's not permanent. This is never, I don't ever go into these kind of treatment plans and want someone to be eating this way for the rest of their life. This is always, we're trying to have a therapeutic outcome, I suppose. So it can be months, and it can be really, really hard. And I've done it myself. It is hard. You can't really, you can eat out, but not really. I wouldn't recommend it. It's hard if you get invited to people's places for dinner, and you do become very restricted, and you have to plan ahead, and you have to eat really simple food if you can't plan ahead, and it gets a little bit boring. But I guess it's all about values. This is something I also reiterate. If you value your health more highly than you value, your social life or your, the entertainment from eating at a fancy restaurant, and it doesn't have to be forever, but pick your health first. And once that falls into place, then everything else can come back in. You can have it all. It's just, it takes some commitment. Even in terms of treatment with supplements, we can't just jump in and do everything at once. So I like to say to people, it's like when you go to the gym. You would never go in and expect that on day one, after never exercising, that you could deadlift 100 kilos. It's unrealistic, and I don't think we would have that expectation of ourselves in that environment. But it's almost like when it comes to health, we are kind of conditioned to think that we could take something and just have a quick fix, and it's not. Sorry. Gosh, I'm really the fun police, aren't I? I can't eat all these foods. It's going to take ages, and I feel like I'm constantly the bearer of bad news. But I actually don't want this to be a negative thing. I really want to do these videos so I can empower you and allow you to know that there are so many options that you can explore, and there is a way out of everything that you're experiencing. And with a little bit of patience and a lot of commitment, you can feel so much better. It can be done. You may not nail it the first time either. So, sometimes you have to try a few different treatment approaches, so a few different antimicrobial supplements, a few different tweaks to your diet. Like it takes some time, but I guarantee you that if you can commit to that time and you can just be on board. And I also would recommend sticking with one practitioner. It doesn't have to be me. If you're already working with someone, then trust them and talk to them. And if you feel like something's not working, don't just stop taking it, and don't, drop off the planet and 6 months down the track try someone new. Like, have that conversation. If you feel like you don't resonate with that person, or you feel like they don't quite get where you're coming from, or that they're not being open-minded themselves, then of course, like, look into somebody else. But you have to go through the different stages. So make sure that you're in a resilient place where your gut can actually cope with the antimicrobials going in, then tackle it with antimicrobials. But that can take time. You have to rotate between different herbs, and not allow those organisms to, I guess, set up that resistance. Have to be constantly re-inoculating your gut with good flora, so probiotics. You can do that through food, but some people are so depleted that, and I say often, there's some conditions that you just can't eat your way out of. So yeah, lots to think about, but lots that can be explored. And absolutely, if I get to a place with my clients where I feel that nothing's changing, then yeah, sometimes we do need to look at antibiotics. And for some people, that changes their life. And to be honest, I considered it myself. So I was diagnosed with blastocystis a couple of years ago, and I did some herbs, and I'm naughty. I was not overly, I was really committed for a while, but there was something else going on. The treatment wasn't sticking as much as it should have, and I almost went down the antibiotic route, and then I had the diagnosis of endometriosis, which made so much sense because it was basically impacting how my bowel was functioning, how everything in my gut was functioning, and it was creating this massive inflammation. So as much as I was doing things and it would kind of feel a little bit different and be a little bit better, I always had this underlying other thing that was driving up my inflammation and creating other issues, so I couldn't ever quite see. So now I feel like I'm at a point where I could explore the natural treatment again, but my situation's totally changed since I've had the surgery. So anyway, that's another video. We'll get there eventually. I know I keep saying that, but I will. I promise I will share more about my story. I'm just, I don't know, wrapping my head around it and figuring out where I'm going as well. So, hope that was informative. There's, so much to be said, as with everything health. So I'm just going to keep pumping out these videos with whatever you guys ask for or whatever comes to mind. But if you are experiencing gut issues, then please reach out either to myself or another practitioner. And maybe I will do some more, put some more info up about the testing, because I feel that's really, really important. A lot of practitioners do send for tests, but when they're not the most comprehensive or the most accurate, then it's not really worthwhile. Better to go in with the big guns, suss it out properly at the start. Anyways, have an amazing day, and thanks for watching, and I'll chat to you soon. Bye.